Welcome to New Hampshire's Business. I'm Fred Coker. Let me read you a paragraph from a story that was put together by the Granite State News Collaborative, which is a group of news outlets across the state that pool their resources to report on stories. This story is called Restoring a Broken System, and let me read you the paragraph, the first paragraph of their story. It was out just in March. Once ranked among the nation's best, New Hampshire's mental health system has steadily eroded since the turn of the century and grown more distressed in the past decade, as the demand for mental health services has far outrun the capacity to provide them. Now, here are some of the things that were in that story that make the point. 48.3% increase in suicide rate 1999 to 2017, a 350% increase in the number of mentally ill involuntarily held in hospital emergency rooms waiting for admission somewhere in New Hampshire. Then, primary care physicians paid 50% more than mental health providers for the comparable services. Spiraling losses by businesses over mounting workers' comp costs and frustration by employees over delayed treatments. Now there are fixes, and it's a 10-year plan by the state, $21.7 million in the next biennium to start restoring the system, an increase in reimbursement rates by $3 million, new forensic hospital for civilly committed, then residential treatment facility for children, and $1.9 million for suicide prevention and education. With me to talk about this are two people who are committed to this restoration. They are Senator Tom Sherman, State Senator from District 24, which is on the Seacoast, and you live in Rye.
Yes.
Welcome, nice to have you here.
Thank you.
Ken Norton, Director of NAMI, which is the National Association on Mental Illness, and you are Director of the New Hampshire chapter. Welcome, Ken.
Correct, Alliance on Mental Illness.
Alliance, right. Ken, how did we get into this broken system?
In historical context, in 1957 as a state, we were 750,000 people, and we had 2,700 adults in our state hospital facility in Concord. 60 years later, we're 1.3 million, and there are 144 adult psychiatric beds at the hospital. In between, as you mentioned, we were rated #1 in the country in the early 1990s for our community mental health system. And, but since that time, we had significant deterioration of the system, followed by the recession in 2007 to 2010, and we just let services and support slide. And the way back is to rebuild a strong community-based system of care, the foundation of which is in that 10-year mental health plan.
From what I've done my homework, the number of cases has gone up, but the funding and the workforce has not. Is that about right?
Yeah, I mean, I think that's true, but it's more complicated. There's rates, there's lack of available services in communities. There's closure of private psychiatric hospitals and inpatient public hospital beds, so a lot of complicating factors.
Senator, you have taken this issue on headlong in the state Senate this year with Senate Bill 11. Just tell me what that bill would do and just your view of this problem and what this bill would do.
Yeah, well, thank you for asking. So my background, I'm a physician myself, and it's the idea that the Senate Bill 11, the thrust of it is that we have several different components to the crisis on mental health. One of the components is the outpatient issue, people not being able to be seen. But the most egregious right now is that we will have anywhere from 25 to 70 patients sitting in our emergency rooms across the state, maybe having one mental health visit a day. They are there against their will. They are a danger to themselves or others, so they can't leave. And they're waiting for a bed. They can wait there up to 32 days. In my committee, we heard that. So SB 11 is a comprehensive approach to actually try to stop that practice in the state. It is not fulfilling all the tenets of the 10-year mental health plan, but it is to address that one egregious practice that is ongoing in the state. And at the same time, it will have some impact on the 10-year mental health plan.
And to add beds.
And to add beds. So it does have several components. But one of the most important is to make sure that when somebody comes into the emergency room, they have a place to go. They're not sitting in that emergency room.
We could talk about this for an hour because it is a complex, yet in some ways a simple solution. A complex problem, simple solution. Thank you, Tom Sherman, State Senator from District 24, and Ken Norton, National Alliance on Mental Illness, NAMI. And we'll probably revisit this when the solutions are made. And thank you for being here. If you want to listen to that again and look at some of those numbers and just consider the problem, go to WMUR.com, click on menu at the top left-hand corner, and then scroll down and click on local news, and then scroll down again to New Hampshire's business.